I think we are going to have a very enlightening session today. 6 speakers, or rather 6 topics by 5 speakers. And then we are going to have a panel discussion moderated by Mr. Joy Chakravarti. So the first talk is going to be on why. It's by Madam Gracy Mathai. She is going to talk about engage and elevate the voice of patients. Why do we need to engage and elevate the voice of patients? She doesn't need any introduction at all. A very senior fraternity in healthcare quality in India. Madam is currently the CEO of Baby Memorial Hospitals in Kerala. Over to you, Gracie, Madam.
Thank you, Lallu, for this wonderful initiative of CAHO, that is engaging patient for patient safety. Each one of us will agree with me and the entire CAHO group that we try our level best to satisfy a patient. We do our best to bring the best outcome. Unfortunately, we can see our people or our patients are not happy always. So we thought we will join with the WHO Patient Safety Initiative, and at CAHO also we will observe that patient voice is to be heard. So engage and elevate voice of patient is very important for us in order to see the patient safety is involved. Now let us look into why this is important. The World Patient Safety Day 2023, the theme is engaging patient for patient safety. The global campaign for World Patient Safety Day 2023 has proposed a wide range of activities for all stakeholders, including national campaign, policy forums, advocacy, and technical events and capacity building initiatives. Why we again look into that? There is an increasing medical error, and the consequences of these medical errors are enormous. Let us look into one or two. Trust deficit. Medical errors can lead to a loss of trust in healthcare providers and the healthcare system. And this can make patients less likely to seek medical care, adhere to treatment plans, or engage in preventive health behaviors. Now, again, the consequences are not only on patient, it is on the providers also. Each one of us will believe that whatever we deliver, and if the satisfaction is not there from our patient side, we also will be dissatisfied. So there is a great impact on us also. Medical errors can contribute to healthcare providers' burnout. This can occur due to the emotional impact of making an error, fear of violence, legal repercussions, and the added stress and workload associated with managing the aftermath of an error. Medical errors can lead to malpractice lawsuits, which can be costly and time-consuming. This not only affects individual healthcare providers, but can also lead to increased insurance premium for the healthcare organizations. So what is the remedy in order to avoid this medical error and bring utmost satisfaction by our patient? The remedy is only one, that is patient engagement. Patient can provide unique insights into the healthcare delivery process from their perspective. Their experience can identify gaps in our care, communication failures, and areas for improvement that healthcare providers may not be aware of. We always think that we give the best care, but we forget that whether the care what we have given is being to the satisfaction of our patient, which only they can voice out. So patient empowerment can enhance trust between patients and healthcare providers. Trust is a fundamental aspect of the therapeutic relationship and can influence the treatment outcomes in our patient. So there have to be a shared decision making between the patient as well as the healthcare provider. And that healthcare provider can be in any cadre. It can be a doctor, it can be a nurse, it can be other healthcare worker. But we have to see that shared decision making is being taken with the help of the patient. Empowered patients are more likely to participate in shared decision making. This involves collaborating with the healthcare providers to make healthcare decisions that align with their personal values and preferences. Patients who are informed and engaged in their healthcare process are more likely to follow treatment plan and manage their healthcare conditions effectively. So, what is the ultimate aim? What is the ultimate key? Engaging with patient is the only key to improve patient satisfaction and to avoid medical error. Thank you for your listening.
Thank you very much, Gracie ma'am. We do agree that engaging with patients is the key. And that's the beauty of this exercise that we are going to be embarking on. How are we going to engage with the patients? Now, to talk about